Joyce, I wanted to highlight a paper that you worked on a number of years ago now about enrollment into studies, and perhaps I'll just let you talk to your work.
Well, to the point you were making, Mark, we've recognized that unfortunately African Americans were disproportionately impacted by hepatitis C. But when you looked at outcomes in studies for hepatitis C clinical trials for treatment, they were underrepresented there. And that's not unique to hepatology and GI and hepatitis C, but particularly disturbing given what we've talked about to this point, right? These astounding ratios with respect to the disproportionate burden of disease. And so we wanted to look at the major hepatitis C studies to understand, so how does this really play out? Are we seeing African Americans, the group most adversely affected by this disease, represented in these clinical trials, right? I mean, does that help us understand why it took us so long to recognize some of these differences with respect to outcomes? And should we have done a better job of predicting what we would see in terms of use of interferon if we had appropriate engagement with African American populations in those earlier clinical trials? And you can see here that we show that there was pretty much a significant difference in terms of African Americans not being proportionally represented with respect to the population of patients in these clinical trials for hepatitis C.